Hi there, my name's Dr. Hayley Trower and I work at the University of Warwick. In today's presentation, titled Behavioural Issues and Support for Children with Growth Conditions, I'd like to share with you a tool that my team have developed that parents and carers can use to help to understand children's behaviour. It's called the Behavioural checklist and it's for parent carers to use to help to think about the causes of behaviours of concern or behaviours that challenge. And so I will also talk a little bit about what behaviours that challenge look like and how they are related to the Behavioural checklist. So the Behavioural checklist is downloadable as a PDF from the website here. So the Cerebra charity, they are a charity that focus on children with brain conditions. So if you go onto this link, you'll be able to download a copy of the checklist and you are free to use it as you wish. So why do we even need a checklist? Well, as you may know, there is a high prevalence of behaviours that challenge in children with growth conditions, complex needs, learning disability, developmental delay, and so on. Behaviours that challenge tend to include specifically aggression towards others, self-injury, such as head banging, biting, scratching. It could be destruction of property, and it could also be other behaviours like shouting or swearing, which is why we sometimes use the term behaviours that concern as well, because there may be other behaviours that we haven't included here. And this graph just shows the difference between children who do not have learning disabilities and children who do have learning disabilities, and it just shows the prevalence of behaviours that challenge and the difference between them. You can see that children with learning disabilities tend to have a higher prevalence. Another reason is that parent carers often report not knowing where to begin when it comes to behaviour. So you might be thinking, where do I start? I don't even know what questions to ask. You may also be thinking, what if my child can't tell me what's wrong with them? How do I understand what's causing the behaviour? So the checklist summarises important things to look out for to discuss with a healthcare professional, and it helps parents and professionals to then keep a record. The development of the checklist was led by Professor Chris Oliver at the University of Birmingham and colleagues, and it's based on more than 250 scientific articles and decades of clinical service. So it's based on lots of literature and lots of experience. It helps to understand behaviour and well-being in people with intellectual disability, with developmental delay, and with complex needs, particularly those with few or no words. And it can provide parent carers with a list of the most common causes of challenging behaviour. It also helps to monitor changes in behaviour over time, so you can fill out the checklist every 2 weeks, once a month, once every few months, several times over a matter of weeks or months, and you can fill it out as many times as you like. It also guides conversations between the parent carer and their paediatrician or other health professional during routine appointments. So the idea is that once you've completed it in your own time at home, you could then take the checklist to a routine appointment with your paediatrician or another health professional to then help to structure the conversation about what to do next. It can also therefore help to streamline referrals, and the aim is to reduce distress levels over time because it's aiming to reduce the behaviour that challenges as a result of better understanding the cause of that behaviour. So what are the causes of the behaviours that we've identified? Well, they are listed here. We call them the checklist items, and there are 11 different causes. So the first 9 are internal characteristics. These are characteristics that are happening inside the child. They are internal. So number 1 is pain and discomfort. We've got sensory problems and sensitivity, anxiety, low mood, sleep difficulties, emotional outbursts, impulsivity, insistence on sameness, and social differences. But also communication and learned behaviour are important as well, and these are more like external characteristics. So every person really needs to be able to communicate certain things, like whether they want something to start, something to stop, whether they want something to drink or something to eat. And so if they can't communicate those basic things, then this might lead to a behaviour that's concerning or that's challenging for you. Also, behaviours can become learned over time. Associations can be made. A child might have a particular behaviour where they know that if they do this certain thing that they will get attention from their caregiver. So that's a learned behaviour, but those can be quite difficult to spot. Of course, more than one of these items might be experienced at any one time, and then they may also be related to one another. So poor sleep might be because the child is in pain or is experiencing discomfort. Anxiety might be leading to poor sleep, and vice versa. So I just want to talk to you now about how the checklist items are related to behaviours that challenge, and I'd just like to give 2 quick examples. So the first item, pain and discomfort, this is arguably the most important checklist item because it relates directly to distress, but it is often overlooked. So for example, when dental pain and ear pain are treated, the pain is often relieved, which means that the behaviour will also stop as a result. So 15% of all children with an intellectual disability will headbang between the ages of 1 and 4, and 50% of these children have a middle ear infection. So there's a really big relationship here that we can see between a middle ear infection and self-injury through headbanging. Gastrointestinal disorders such as reflux and constipation are also common in children with growth conditions and intellectual disability because different parts of the body don't develop properly. So reflux can cause middle ear infections and tooth decay, and that's because stomach acid is moving back up through the esophagus into the mouth, and sinuses, which can cause inflammation, irritation and pain. And so these kinds of pains are common causes of distress and self-injury, and so that's why children who have got a middle ear infection might be headbanging because they're in pain, or if children who have got some kind of gastroesophageal reflux or other kinds of digestive issues, again that might be causing pain up in the middle ear or in the mouth or in the sinuses. Pain and discomfort is also related to other checklist items, like I said, particularly sleep and mood. So there's another relationship there. And there are 4 mechanisms by which pain and discomfort might influence behaviour. And I just want to talk briefly about those here. So the first one is that the behaviour attempts to remove the painful stimulus. For example, somebody might put their fingers down their throat as a response to the reflux. So they're physically trying to change the reflux or reach the source of the pain. Pain gating behaviour is also a possibility. So this is where acute pain created by self-injury can block long-term chronic pain. So if you've ever banged your elbow and then rubbed it to help it to feel better, you're essentially replacing one sensation with another. So that's like trying to block one pain with another. And then pain via routes 1 and 2 can then cause the first instances of behaviour, and then it can be subjected to social reward. So then behaviour happening because the child is anticipating a social reward, that can happen. Or that pain can be a learned behaviour. My head is covering up that one, but that basically says that behaviours can then become learned behaviours. And so in children who are non-verbal, if you need to, it's hard for them to tell you that they're in pain, of course. So there are likely indicators of pain. So this might be changes from the norm, such as a change in mood that's associated with self-injury, for example. We would say that parents are, of course, usually very aware of when their child is in pain because they can recognise the change from baseline. However, we have found that parent carers do report a lack of acknowledgement of pain from professionals. But I would say, go with your gut, trust your instinct. If you think that there's that your child is showing discomfort and pain, then you probably know your child best. So I would see if you can get it checked out by a professional. Okay, and then the next example of how the checklist items are related to behaviours that challenge is the item of anxiety. So anxiety can be a cause of behaviours that challenge, and I'll just provide an example here. So there is a situation such as a parent is walking their child to the park where there might be dogs. Then the child might feel anxiety, their heart rate increases, they feel tense and worried. Their child is vigilant for danger then, the child's attention becomes focused, they're looking for dogs as they approach the park. The child then engages in the behaviour to escape any dogs. They will refuse to go into the park possibly. They might pull the parent's arm to move away from any dogs that come near. Then the child might experience short-term relief, but then long-term anxiety might increase because there is a loss of confidence in coping. The child is more likely to use behaviours to avoid dogs in the future. The parent is more likely to avoid the park in the future, and so that anxiety will actually increase and the potential for coping decreases. And then that circle will just keep circling itself. So apologies, I've missed the T off here, the checklist. So I'd like to talk now about completing the checklist. So what it actually looks like, how would you complete it, and I will provide an example as well. So first of all, when you download the checklist, you'll see that it's about it's actually about 20 pages long. Most of those pages are guidance, some guidance on how to complete it, a bit of info about each of the items and an example of how to complete it. And then as you move towards the back of the PDF, you'll see the record form, and this is where you would actually fill out the record form. So the first thing that you would come to that you would need to fill out is this section on naming the behaviour and understanding the impact of the behaviour. So you would put the date, you'd select behaviour 1, or you'd write in the box here behaviour 1 that you'd like to change. You could add another 2 behaviours, or you may just want to focus on one at a time. There is some guidance in the checklist about how to name the behaviour. So the idea is that to be as specific as you can be, but it may be that there are lots of behaviours and you don't really know which one to start with, in which case there are some questions to ask yourself that we've provided in the guidance. And then you would rate the frequency, which is a rating of 1 to 5, and the response, and again a rating from 1 to 5, and I'll explain that in a moment. So yeah, so the frequency is how frequently is the behaviour occurring, and then the response is how often does someone need to intervene with the behaviour. And then there is a well-being rating as well, which is in the past 2 weeks, how would you describe your child's well-being? And so the rating scale looks like this. So for the frequency, you would give it a 1 if you think this behaviour will occur by this time next month. You'd give it a 2 if you think it will occur by this time next week. It's a 3 for by this time tomorrow. It's a 4 for in the next hour, and it's a 5 for in the next 15 minutes. So if you're giving it a rating of a 4 or a 5, this indicates that this requires attention. And then rating the caregiver response, how often does someone need to intervene? I'm just looking at my other screen because the slides are bigger on that screen. So a 1 is never, a 2 is at least once a month, 3 is at least once a week, 4 is at least once a day, and 5 is at least once an hour. So again, you would, if it's a 4 or a 5, this is the higher rating. So this, shows that there is quite an impact being caused here, potentially. And then the well-being. Again, there's a rating scale from 1 to 5. 1 is no signs of distress at all, and it ranges up to 5, which is very distressed for long periods. And we would hope that after completing this a few times and actually understanding the behaviour and perhaps receiving some kind of treatment or intervention, that well-being rating would come down over time. So we've already gone through the checklist items, but each item has a bit of guidance next to it. So for example, for pain and discomfort, we've got here signs to look out for. So signs to look out for may be facial expression, crying, groaning, screaming, can't be comforted, things like that. And then in the notes box, we've got a little bit about how the item might relate to the other items. So pain affects sleep. It can cause the behaviour to start in the first place and then it later becomes learned. Pain can also make learned behaviours more likely to occur. So you'll see a box like this for each of the checklist items just to give you some pointers. And then you would provide a rating from 1 to 4 for each item. And again, it ranges from 1, there are no signs of this at all. 2, there are some signs but it's not really a concern. 3, there are definitely signs and it does cause concern. Or 4, there are definitely signs and it's a significant concern. Or you might find that you're not sure, and so you would need to check. And so you'll end up with one of these ratings for each of the first 10 items, and then communication as well. There are lots of sub items under the communication heading as well, but I won't go into those today. But again, it's like something to eat, something to stop, something to drink, things like that. So yeah, so then you'll find that you might have a few high ratings and a few low ratings, and that you may then be able to see how some of the checklist items interact with each other as well as with the behaviour. So I'd like to share with you an example now of how to use it. So Peter is 7 years old and he has a severe intellectual disability and he shows some autistic characteristics. He's able to walk and he can use a few Makaton signs, but he needs help with all self-help activities. His hearing and vision are both good and he is not on any medication. His sleep is mostly good, but there are some very bad nights when he can't seem to settle and then he wakes a lot during the night. Peter hits out at others on occasion. He also bangs his head on tables and walls and he slaps his face and he can appear quite distressed at these times. Both of these behaviours leave red marks and Peter's parents are worried about the behaviours because it means that they can't take Peter out as much as they would like to, and the behaviours can just start without them seeing a trigger. So Peter's parents estimate that the head banging is likely to happen at least once in the next hour, and that by this time tomorrow they will have had to have prevented Peter from banging his head at least once. They decide to focus on this behaviour, and so on the Behavioural record they name the behaviour banging head on objects or surfaces, and they rate the frequency as a 4 and the response as a 4. Next, Peter's parents think about Peter's mood over the last 2 weeks, and they remember that there were days that Peter was quite distressed and they were not able to comfort him. So on the well-being scale, they've rated Peter a 4 because the distress wasn't frequent, but it was noticeable when it happened. Okay, so excuse me, I'll have to read off my bigger screen. So for pain and discomfort, they can see that some of the signs seem to apply, such as the behaviour comes out of the blue and there is distress at the same time. So they rate that a 3. For sensory sensitivity, they're not sure if this applies because he's never had an assessment and it hasn't been discussed at school meetings. So they rate that as a not sure. For anxiety, they haven't seen any of the signs, but occasionally they might see them when they're at the weekly supermarket visit, and so they rate it as a 2. For low mood, although there are periods of distress that don't last long, they rate it 2. For a 7-year-old, sleep difficulties and emotional outbursts are happening more than would be expected, and so they rate both of those a 3. Peter is quite good at waiting for things, but he does have a strong preference for routine, but they can usually work around this. So they rate impulsive and insistence on sameness. They rate an impulsive 1 and insistence on sameness a 2. For social differences, Peter doesn't really avoid others, but he also doesn't seek others out, and they rate that as a 2. For learned behaviour, they are not sure if the signs apply as they are so concerned with managing the behaviour when it happens. They rate that a not sure. So you can see that pain and discomfort, sleep and emotional outbursts are highest. And then for the communication items, they know that he can always ask for food, drink and most objects, and for social contact and for things to start, because he can use his Makaton signs and he can lead people by the hand. So they rate the communication items a 2. But for wanting things to stop, help or to go somewhere, they're not sure, so he gives those a not sure. And so then looking back over the Be Well record, Peter's parents now have a baseline rating for banging head on objects and surfaces. The frequency is a 4, the response is a 4, the well-being is a 4, which is quite a high rating. So they can now make the same ratings every 2 weeks to see if anything is decreasing. And if so, then this shows that the behaviour is reducing and the well-being is improving. So yeah, so that's a short example of how you might fill out the checklist and what kind of overview it might provide when it comes to your child's behaviour. And then hopefully you can see how that then helps you to, it kind of gives you a framework or a map, and then if you take that to a healthcare professional or even a school teacher or paediatrician, then you may be able to work together with them using that checklist as a framework to then help you to work out what to try next to reduce that behaviour. So that's it from me. Thank you very much. I hope you enjoyed the presentation. Thank you.